Hello everyone, today I'll be discussing the role play that is of the end-stage renal disease patient. But I just want to discuss one thing with you guys, that you people are so much scared about the speaking module. It's not at all difficult because it's just a communication. If you're going to just focus on the communication, you can easily tackle it. So today I'll be discussing the reluctant topic because it is little bit reluctant, and even the topic is little different also, so that's why I'll be discussing the same topic for you guys. So let's start with it. I'll be reading the patient's role first, and then I'll be discussing the nurse role play as well. So let's start with the patient. That you are a 55 years old patient, and you have end-stage renal disease and your health is steadily deteriorating. You are an inpatient in a renal ward and feeling lonely and depressed. You are reluctant to talk about your situation as you are scared. You require dialysis 3 times a week and are on kidney transplant waiting list. So right now the patient is 55 years old and patient is facing problem because he is end-stage renal disease patient and is waiting for the dialysis and dialysis as well as the donor. So that's why you can just think about the psychology of the patient, because the patient is already depressed, patient is scared of the treatment, and maybe he is fed up also, because you might have seen, you people are nurses, you people are aware, and even the doctors, so you people are aware of the things that how the patients are feeling as a end stage renal patient and there is no donor and he's fed up with the waiting list. So this is all about, you have to think over it. And then the first task is the patient will be little reluctant and slowly he's going to explain his fears. And the next point is, tell the nurse you hate having dialysis and feel that a donor will never be found in time. And then the next point is, demand to be nominated as NFR. If you have a cardiac arrest, definitely the patient want that he should be nominated for NFR because he don't want to live if he get a cardiac arrest, and reluctantly agree to see a counselor. And then the next point is, tell the nurse that you won't be able to die with dignity with your family presence. So let's discuss about it. Like, the patient is going to tell you this thing that he is not having hope to live, and even his health is deteriorating day by day, and even he is reluctant to talk with you, and even that patient is not liking the dialysis. Obviously the dialysis is really painful, and how he has to undergo the dialysis procedure almost 3 times a week, so it is really painful. He may ask you a few questions regarding that, so I'll be discussing in elaborative way also. And then he is just going to tell you about the NFR. I hope everybody is aware of NFR. That is, we call it as, in India we call it as DNR, do not resuscitate. So this is the same thing which they are following it in Australia or in abroad. So basically the patient is going to just inform you that he don't want to live if he get a cardiac arrest, so please do not resuscitate. And then you have to just convince him to just to meet a counselor who is going to explain him regarding the proper procedure, then what are the pros and cons regarding the NFR. And then he may even tell you regarding the dignity of his end of life. Basically he just want that his family should be around him when he is going to die. So you have to respect his decision, because being a nurse or being a health professional, we should be aware of it, that we have to respect the decision of the patient. So let's discuss the nurse role play, and then I'll be explaining you each and everything what you can just tell as a nurse and what you have to convince and how you are going to convince the patient regarding this specific role play. So the nurse role play is, your patient is 55 years old and he or she has end-stage renal disease. You see his or her health is steadily deteriorating. The patient is an inpatient on renal ward, and you notice that she or he appears lonely and depressed. She requires dialysis 3 times per week and is a candidate for renal transplant. Now you can easily see that it is totally opposite. The examiner is going to play as a renal patient, and you are already well aware of these things. Okay, and your first task is, ask the patient to tell you how or she is feeling. Yes, so you have to just ask his feelings, that how he is doing, and how, like, you can just start with some general talk as well. Then the second point is encourage the patient to talk about his or her fears about the condition. So basically you have to convince him that he has to talk about his fears, like what all things are coming into his mind and why he is scared of this disease and why he is so depressed. You have to just tell him that, to ventilate his feeling to you. And the third point is inform the patient that without dialysis he or she would suffer more. Of course, if you are going to tell the patient that if he's not going to take the dialysis, definitely his problems will be more. Like, you can just explain him that if a patient is a renal patient and you know that the renal disease is like basically the kidney system is clearing your toxins from your body, or the extra like you can say the waste material from your body, and if you're not going to get this dialysis procedure done, definitely it will be a problem. Even the body may get swelled up, or the other problems will be there with the patient. And then is reassure the patient that there is always hope, a donor will be found in time. Yes, of course, you have to give him hope, because you are a nurse, you are a health professional. You have to convince him that like he'll be getting the donor soon. And then the next point is suggest that a counselor to be consulted to support that the patient's decision to be listed as NFR. Of course, you have to like acknowledge his decision, but yes, you have full right to give your decision as well, or to you can give your suggestion to him or her that he should not go with NFR, he should think about his family and so many other things. I'll be explaining you afterwards. And then the next point is provide reassurance. Then if she wants to put him or her in a request in writing, and it is hospital policy for staff to respect that, and having the family present is important. Okay, so overall now you have a clear idea that what exactly you have to do in this role play. And I just give you a single tip for this thing. Please look for 3 things, that is the role of yours, as well as the role of your examiner, or you can say the interlocutor, or the settings. Yes, now the setting is hospital, you can very well see on the role play card, and you are a patient, the examiner is a patient, or it may be a he or she. You have to just judge according to the gender of the examiner, and you are a nurse in the hospital. So the first thing which you should focus, that is, if you are a nurse and you are in the hospital, definitely the first thing is when the nurse is going for the rounds, how she is going to greet. Because most of the students, they are just following it in this way. Okay, hi, I'm one of the registered nurses over here, how can I help you? How a person is going to approach you in this way? Because if you are a nurse and if you're going to give a warm welcome or a warm greeting to the person, definitely he will explore the things and he may even discuss the things with you. But if he doesn't have trust on you, he will never explain the things. So this is what is the main important thing of this role play, because they have already mentioned this thing that the patient is reluctant. Of course, patient has already lost his hope. He is not even ready to live, because he is going to even discuss the NFR with you. So how you're going to approach him? First, you have to just tell, okay, hi, how are you doing? So, or in this way, you just start the conversation. He may tell you this thing that, okay, ma'am, I don't want to talk to you. Please leave me alone. I don't feel like talking to you. He may give you such answers. So in that scenario, how you're going to convince him? You just tell him, what happened, sir? Please ventilate your feelings. If you're going to ventilate your feelings, you will feel a little relaxed. And still, if he is showing you the reluctance, so what you can do is, you can just tell him that we people are trained in that manner. We are not going to disclose your information to anyone else. We are going to keep this secret, or we are not going to disclose this information to some other person, right? So you have to just gain his trust. Then only he is going to ventilate his feelings. After that, he may start the role play. He may just tell you this thing that as you can say that the patient is end stage renal disease, and he may tell you this thing that, okay ma'am, as I'm an end stage renal disease patient, I know that there is no hope, I'm not getting a donor, I'm waiting for the donor from last 4 or 5 years. So what will be your response? Your response should be like, I can understand sir, I can understand ma'am, it might be very difficult situation for you, but you have to wait for a while, or we are also trying to find a donor, so you may get it soon. You have to just give him a hope, you have to give him the positivity, because obviously patient is already depressed, patient is already scared of the treatment and even regarding this disease condition. So you have to make him aware of those things. And then the next point, you have to just focus that he is going to complain that he is not happy with the dialysis. He may ask you that end stage renal disease as he is suffering from, so what he has to do, and is there any other alternative treatment to deal with it. So you have to just tell him that as you are suffering from end stage renal disease, end means this is the last stage, so we cannot treat you with some medications or injections. There is no alternative we have, so that's why we are giving you dialysis. As I have already explained you regarding the dialysis, you have to just explain it in the layperson language that dialysis is a simple procedure where we are just going to take out the waste material from your body because your kidneys are not working. So that's why, as you can just explain him that the kidneys are just clearing your waste material through urine, so this is what we are doing it with the dialysis machine. You just make him understand that thing. And then as he has already lost his hope and he is going to just explain you regarding the NFR, so you just start with this way that, okay sir, I respect your decision that you are going to file for this NFR or DNR. I respect it, but I just need to know that why you want to go for that. So he may tell you some problems, because most of the students, you people are just keep on explaining, or you are keep on focusing on your role. You never listen to the examiner, you never listen to the patient. This is very much important in the role play. So if you're going to acknowledge his problems, definitely you will get material to speak. Now if I am a nurse, I'll be definitely acknowledging in this way that, okay sir, I respect your decision, but I just want to know the problems, that why you are facing this, why you have taken this harsh decision. So then he may explain you this thing that maybe it can be a financial problem, or maybe like he don't want to be a burden on his or her family. So this can be the thing. So in that scenario, if the financial thing is there, you just tell him that we have a financial counselor or the social worker who is going to help you in this problem, for this problem. So it will be tackled. And if a person is telling you this thing, the burden on the family, so you just have to make him realize that how much his family loves him or loves her. So you have to make him realize that how important his life is. If you're going to convince him in that way, definitely the person will understand the problems or understand your situation as well. And then if he's not still reluctant, you just introduce him to the counselor and just make him understand this thing that yes, counselor is a person who is going to tell you the right procedure, and even he may help you to take the right decision or the right procedure. So he has to meet him, and you are going to just fix the appointment with the counselor. And the last point is, like, if a person is just insisting you that I just want that my family should be around me, like during the end stage, or he just want to go with the dignity, you just tell him that as it is written in your role play, that according to the protocols or the hospital policies, you have to give it in the written, and we can just proceed with the procedure, what exactly the procedure is of your hospital. So this is what you have to do in the role play. And if you're going to focus on the examiner, what he is explaining you, what he is like approaching you, if his approach is positive, definitely you have to approach in the same manner. But if he is negative, but being a health professional, we should be positive. We have to, in between, we have to make him understand that how life is how much life is important and how precious his life is and how precious he is for his family. So this is what about this role play is, and you have to give him positivity. You have to just tell him that be optimistic, be positive towards his life. He has to live for his family, for his children, or maybe whatever, whosoever is there in his family. So just try to learn from your patient only. I still remember when I was in the hospital, when I used to work with the doctors, they always explain us that please listen to the patient, because he is going to tell you each and everything. There is no need to refer the books. There is no need to do learnings from the Google. The patient is himself is a book. You just try to learn from him and you can easily get the maximum information. So please focus on your patient and listen to him carefully. You will get very good ideas and you can attempt it in a better way. This is all from my side. Have a great day.